I'm very pleased to welcome you all to the European Parliament this afternoon, where we will discuss a number of issues ranging from fitness to practice and information sharing in the first session to telemedicine, internet pharmacy in the second session. But there is one unifying thread, and that is patient safety. And the third session will deal specifically with this issue. However, the matter of patient safety will permeate the entire debate. Our first contributor here this afternoon, Dr. Ambrose McLaughlin, said to me a number of years ago, there are 4 priorities in any health system: patients, 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 and patients. And I think that says it all. But of course, our job as legislators and your job as practitioners, healthcare professionals, representatives of health NGOs, Commission officials, all have a role and a responsibility to ensure that patients and their concerns, and in particular patient safety, remain central to all of our work. As citizens of the EU, we have a right to expect and benefit from the 4 freedoms: the free movement of goods, services, people and capital. And part of that includes the free movement of healthcare professionals across borders, and indeed the right in certain circumstances for patients to benefit from medical treatment in another state. Our job as legislators is to ensure that the system works effectively and safely. The Council issued a number of recommendations on patient safety in June of last year, and there are a number of excellent suggestions in the document. But the document is aimed primarily at Member States, with, I believe, insufficient emphasis on the cross-border dimension. And while the document speaks of comparable and aggregate data to be collected at community level to establish efficient excuse me, I'm sorry, I just lost my train of thought here because I'm actually quoting from the document. So while they speak of comparable and aggregate data to be collected at community level to establish efficient and transparent patient safety programmes, structures and policies, and how best practices can be disseminated among Member States, and also the need for common indicators to be developed, the document does not take the final step, and that is the mandatory sharing of information between the regulatory bodies in the Member States. At a personal level, I believe this is necessary if we're to put in place a robust regime to help ensure patient safety. Isabel de la Mata from the Commission, I know, will elaborate on the Council recommendations, while Niall Dixon will set the scene with regard to the regulatory environment that he works in the UK and its relationship to Europe. Finally, of course, we also have EU NetPass, which is the European Union Network for Patient Safety. And this is the platform at EU level for collaboration and networking between 27 Member States, international organisations and stakeholders in the field of patient safety. And they have a number of work programmes, and again I know that Isabel will refer to their work. I think we have a very interesting afternoon and evening ahead of us. I am pleased to chair the first session, which deals with fitness to practice and information sharing. And our first presenter here this evening is Dr. Ambrose McLaughlin. Dr. McLaughlin is the Registrar and Chief Executive of the Pharmaceutical Society of Ireland, the statutory regulator of pharmacy in Ireland. He's former Chief Executive of the North Eastern Regional Health Board and has been a key advisor to the Irish Department of Health and Children on a number of patient safety and public health matters. Ambrose.